In this lecture, we are going to discuss blood pressure, also known as silent killer. First of all, we will look at the definitions of the blood pressure. As the name suggests, it's a pressure exerted on the wall of the blood vessels. So, that is the force exerted by the circulating blood against the walls of the blood vessels, that is blood pressure. And it's a very crucial parameter that indicates efficiency of the heart in pumping blood, whether heart is pumping properly or not, or it is also a good indicator of the circulatory system. Next, we will look at the measurement of the blood pressure. How we will measure the blood pressure? So, most commonly we use the sphygmomanometer for the measurement of the blood, and specifically in the millimeter mercury. So we measure it into two components: systolic blood pressures and the diastolic blood pressures. Systolic blood pressure records the pressure when the heart pumps. So when the heart pumps, in that case, the blood pressure in the arteries will be maximum in that case. So that will be systolic blood pressure. In the diastolic blood pressure, that is the lower one. And in that case, heart will be in rest. So in resting state, the pressure in the arteries or the blood vessels will be diastolic. Normal blood pressure is 120. That will be the systolic, and 80 millimeter mercury, that will be the diastolic blood pressure. Normal versus abnormal blood pressure, that is according to the American Heart Association and the WHO. Normal blood pressure, systolic blood pressure less than 120 and the diastolic less than 80. Elevated 120 to 129 and diastolic less than 80. Hypertension is stage 1, 130 to 139 and diastolic 80 to 89 millimeter mercury. Hypertension is stage 2, equal to or greater than 140, equal to or greater than 90. Hypertensive crisis greater than 180 and greater than 120. Next, what factors that affects the blood pressure? First one is the cardiac output. Cardiac output, the amount of the blood the heart pumps per second, that will be the cardiac output that actually increase the blood pressure. Peripheral resistance, more the resistance, more will be the pressure in that case. So peripheral resistance in the blood vessels also affects the blood pressure. Next, blood volume, more blood in the circulatory system increases the blood pressure. Blood viscosity, thicker blood exerts more pressure against the walls of the blood vessels. Elasticity of the arteries, stiff arteries cause high blood pressure. So as we know, in old age, arteries become stiff. So in that case, in old people, blood pressure normally high. So this is one of the reason why old people have normally higher blood pressure as compared to the young one. Next, regulations of the blood pressures. So our body controls the blood pressure through several mechanisms, through nervous system, through renal system, and through hormonal system. First one is the baroreceptors. These are the specialized sensors in the arteries that detect the blood pressure and change it. Renin, angiotensin, aldosterone system, RAS, that is the most important system, hormonal system, regulates the blood pressure and the fluid balance in our body. Antidiuretic hormone, ADH, that retains the water in our body and ultimately affects the blood pressure. Sympathetic nervous system control vasoconstriction and heart rates. So this is the processes that actually happening in our body. Next, we will discuss hypertension and hypotension, high blood pressure and the low blood pressure. When blood pressure remains consistently elevated, increasing the risk of heart disease, stroke, and kidney failure and other complications. When the blood pressure remains consistently high, that will be the hypertension. So, what will be the causes of the hypertension? We have categorized it to the primary and the secondary one. In the primary, there will be the no identifiable cause, but it can be related to the genetic factors, age of the person, and the lifestyle, sedentary lifestyle, and whatever. So, it also depends upon the lifestyle of the person. Second is the secondary cause, means due to the blood pressure changes or hypertension due to the kidney disease, hormonal disorders, and the medications that the person is taking. Next, what will be the symptoms in the hypertension, high blood pressure? Mostly asymptomatic, means that's why we call it silent killer. And if the symptoms appear, that can be major symptoms: headaches, dizziness, shortness of breath in severe cases. Treatment and management of the high blood pressure or hypertension. Lifestyle modifications means change diet, doing exercise, and reduce salt intake. That is the most important one. Medication, ACE inhibitors, beta blockers, and the diuretics that regulates the blood pressure in our body. Next, second is the hypotension, low blood pressure. So in that case, BP, blood pressure, is lower than 90/60. Systolic means diastolic. And in that case, dizziness, fatigue, and the shock can be seen. Next, what will be the causes of the hypertension? Dehydrations, low levels of the water in our body, blood loss due to some accident, and some other reasons that also cause the hypotension. And mostly it is seen when the persons get hit by some accident. Then in that case, loss of blood happens, and ultimately persons go towards the shock. Heart problems can also be the cause of hypotension and endocrine disorders. Next, treatment: increasing fluid and salt intake. That is good for hypotension, low blood pressure. When the person is feeling low blood pressure, then the increasing fluid and the salt intake will be the better option. Treatment underlying conditions and medication to raise blood pressure in severe cases, that will be decided by your local physicians according to the conditions of the person. So, what we have summarized. So, blood pressure is a key indicator of cardiovascular health. Whether your heart or the blood vessels or the blood is in good state or not. So, it is decided by the mainly blood pressure. Maintaining normal blood pressure throughout a healthy life and regular monitoring is essential. That will be helpful in the prevention of the heart disease, stroke, and the kidney disease. So this is all about the blood pressure. If you still have any question, you may ask in the comment section. But keep remember, it's just for educational purposes. Final decision will be made by your local physicians or the cardiologist. So thank you so much.